Hello and welcome to today's lesson. Today we'll be talking on measles, which of course is a viral disease. And it's highly contagious. That means we need to be very careful when we are in public places and when somebody sneezes or when someone coughs. We need to be very careful. Well, the pathogen that causes this measles is from the Paramoxyviridae family. And the route of transmission is direct contact with or inhalation of virus containing droplets, which peaks 4 days before and 5 days after the rash develops. The disease is highly contagious, as I have earlier said, because it's SARS 90%, more common in developing countries, and of course, it's more common in children with age range between 5 to 10 years. This is the age that the virus targets, 5 to 10 years, more common. That it doesn't mean that it doesn't affect adults, but it's more common in children. They are more prone to the measles virus. So of course, for the clinical features, it starts with the incubation period, which is approximately 2 weeks after the infection, which starts, and also the prodromal stage, which lasts 4 to 7 days, with symptoms such as coryza, cough, and conjunctivitis. It also comes along with Koplik spot, considered as a pathognomic of measles. It appears opposite the lower second molars on the buccal mucosa on the second or third day of the illness, as gray or white lesions resemble grains of sand with surrounding erythema. Also, we have the erythema stage. As natural antibody develops, the micropoplar rash appears, spreading from face to the extremity. Duration lasts 1 to 2 days after the erythema and approximately 7 days. For the recovery stage, the cough may persist for another week, and it may be the last remaining symptoms. For the erythema stage, it comes along with symptoms such as high fever, malaise, and also generalized lymphadenopathy. For the erythematous micropoplar blanching, partially confluent eczema, these are all the symptoms that are attached to the erythema stage, which usually begin in the face, frequently behind the ears along the hairline. It disseminates to the rest of the body towards the feet. The rash begins to fade after approximately 5 days of onset. So as I've explained in the earlier slides, this is the pictorial representation of what I've just concluded in explaining. Of course, the pathogen is from the Paramoxyvirus and family, and the cause of the therapy is improvement of exanthem with fine dissemination after 4 to 5 days. This is the cause of the therapy. For the complications, we have SSPE and mesoencephalitis. These are what we will be observing during the treatment, or what will sometimes hinder the treatment, the SSPE and the measles. For complications, we have the bacterial superinfections, which come along with otitis media, pneumonia, and laryngotracheitis. Also, we have the gastroenteritis and viral giant pneumonia, acute encephalitis, acute disseminated encephalomyelitis may also develop within weeks. Of course, we have subcutaneous sclerosis pancytophylitis, which is the SSPE, and it's a lethal generalized demyelinating inflammation of the brain caused by persistent measles virus infection. So this is what this SSPE is all about. So investigations. How do we investigate this particular virus? We investigate it using clinical evaluations, which include microscopy and serology. And for the serology, we look for the IgM, immunoglobulin N antibody. Using the gold standard, we detect for measles-specific immunoglobulin M. Also, we look for immunoglobulin G antibodies. The isolation of virus in human embryonic or monkey kidney cells, we look for that also. And during prodromal stage, the giant cells can be demonstrated in nasal mucosal spheres. During the prodromal stage on the microscope. Cytopathic changes seen after 5 to 10 days can also be seen. together with multicellular giant cells and intercellular inclusion bodies. We can see also the decrease in leukocytes and decrease in platelet also. These are in the blood. And identification of pathogens, how do you identify them? We identify them using direct smears. For the treatment, there is no specific antiviral treatment, only supportive care. An antibiotic drug can also be given on the way for fever. Bed rest and adequate fluid administration can also be given to the patient. Management of complications can also take place. And the administration also of vitamin A is key to managing the severe measles infections. Corticosteroids are of little value, so you don't stress yourself about that much. Prophylaxis, we use the MMR vaccine, measles, mumps, and rubella vaccines. This is what we use along the way till symptoms get to be better. Because there is no specific treatment. We only support the individual with vaccines and some other supportive cares. So don't forget to subscribe. Thank you.